Rodgers for 5 minutes for her opening statement.
Thank you, Mr. Chairman. And first, just let me say thank you to all of you, to the chair, to the ranking member, to my colleagues, to the extraordinary staff. Given my announcement last week, I am blessed. I am blessed. And it has been a tremendous blessing to lead this committee, just extraordinary. I can testify that being the chair of the House Energy and Commerce Committee, the best committee on Capitol Hill, is the best position in the House, and it's been a privilege and honor for me to lead. And I'll just say, you know what? We're going to finish strong. We have a whole year ahead of us, and we have a lot of work to do. And I look forward to working with all of you on important issues, including the issues that are before us today, the bills before the Health Subcommittee. So just a big thank you, everyone. I've said it many times, and I will continue to say that this committee is extraordinary because it has a rich history of plowing the hard ground necessary to legislate. And it means coming together to get things done, to get results. And I'm proud of our efforts so far this Congress, like the Lowering Costs, More Transparency Act, which are fundamental to driving down the cost of care and fixing our broken healthcare system. And today we're focusing on 19 bipartisan bills that support patients, caregivers, and healthcare providers. Specifically, we will examine proposals to help improve our understanding of various diseases, disabilities, chronic conditions, and stillbirths. We'll look at legislation to continue support for emergency medical services and healthcare providers, to reauthorize respite care resources for family caregivers, and to prevent organ transplant candidates from being denied a transplant based solely on having a disability. I look forward to hearing from our witnesses today. Thank you for being here about the importance of these programs. I especially am excited to be moving forward on the Deandra Dixon Include Project Act of 2024 that I've introduced alongside with Representative Diana DeGette, Tom Cole, Rosa DeLauro, and Eleanor Holmes Norton, and I expect all of you to co-sponsor this bill. No, anyway. You all know that my mission here has been to improve the lives of individuals with disabilities. And that's why I'm proud to champion this bill that would provide important congressional oversight and direction for the Include Project at the National Institutes of Health. It was established by a congressional directive in 2018, Include. And it's also known as the investigation of co-occurring conditions across the lifespan to understand Down Syndrome Project. And it conducts research on critical health and quality of life needs for individuals with Down syndrome throughout their lives. And at the time Include was established, Down syndrome was among the least funded genetic condition at NIH, despite being the most common chromosome abnormality. So I just want to underscore how important it was that Congress took action to make sure that Down syndrome was a priority at NIH. You know, the individuals with Down syndrome are affected by many of the same diseases and conditions that we're examining across the board. The good news is that individuals with Down syndrome are living longer than ever. But they're developing Alzheimer's or dementias like at 100%. There's no case of an individual with Down syndrome having a tumor cancer, yet they have a higher likelihood of juvenile leukemia. And so when we are looking at research that benefits those with Down syndrome, we also have the potential, as we continue to focus on the 21st chromosome and some of the specific issues related to those with Down syndrome, that will benefit millions of people who battle these other conditions, whether it's Alzheimer's, cancer, heart conditions, that are not just that are common but hardly limited to people with Down syndrome. So this is bipartisan legislation directing NIH to continue this important work on Down syndrome research to help everyone with Down syndrome and their families. And I'll just say once again, we have a lot of work ahead of us. These are important bipartisan bills. And I look forward to continuing to work with each one of you over the rest of this Congress to continue to improve the lives of the people that we have the honor and privilege of representing all across this country. A big thank you again to the witnesses for traveling, for being here today, sharing your insights and expertise. We look forward to your testimony. And with that, I yield back.
Thank you. The chair yields back. The chair will now recognize the ranking member of the full